Hi, Don here. Welcome to Podiatry Practice Mastery. We're helping you bring your practice to the $1 million mark and beyond. So this is a recording of a Thursday. So this is the Thursday before the 4th of July. Kind of go over the patients, and I always think it's good whenever we're going through our patients if we can look at our schedules and figure out what are the ones that are the kind of most valuable patient. Okay, so first patient was a 52-year-old that came in for Achilles pain, and he was also here for a Lamisil booster. So just so you know what a Lamisil booster is, I do Lamisil for 90 days, then I see them back and I do a booster dose, which is a much lower dose for 6 months, and then back to a normal dose for another 2 months. So I give him another 90 pills. He also he said, by the way, hey, I have some Achilles pain. So he started with my Pelto special, which is the night splint, foam rolling, morning stretch. And if things aren't getting better, then we'll do an ultrasound and possible Shockwave at the next visit. So I'm going to see him in about 2 months back. Next patient was a 61-year-old. He was Shockwave number 1 out of 4. Usually I do 6 Shockwaves, but in this case he did 4 because I think he's going to be taking a trip. So we're going to get those 4 in, then he's going to take a little vacation, then we'll see how he's doing back afterwards. Next patient was a 62-year-old. This is a fungus number 1. So with nail fungus, I used to do a nail sample and then see them back in 2 weeks to go over the nail sample. Right now, I just say, hey, we could do a nail sample, or I could just kind of start and speed things up for a couple weeks for you. And most patients want to do that. He had some fungus, he had some athlete's foot, and I said that the pills will clean both, so you don't need anything else. And he did my kit. And the kit is he does a UV light once a month, a shoe spray once a week, and other things like that. So all these are on my treatment sheet, so if you don't have my treatment sheets or you want to get links to them, just shoot me an email, don@podiatrypracticemastery.com, and I'll feel free to send those out so you can see kind of what I actually give to my patients. Next patient was a female. She had bilateral IPJ ulcers. She's had these chronically, debrided those down. She comes back pretty much monthly. She does her own bandages. She has her own razor blade. She does not wanting to do any other surgery to help heal these, and she's type 1 diabetic with neuropathy and just has had these chronically. Next patient was, this is kind of one of the most valuable patients. So he is a gentleman. He came in with pain to the second med head. He is a hiker, and he is here for his first Shockwave. So I did Shockwave number 1 out of 6. He wanted to pay for speed, so he wanted to do Shockwave every 3 to 4 days because he wanted to get them done because he wants to get back to hiking as soon as possible. So we're going to do 6 sessions. He also had some redness on the top of his foot, so I gave him initially an antibiotic. I don't think it was an infection, but there was redness there, and I also tested him for gout, and the gout actually came back negative. So he's going to be seeing me every 3 to 4 days. Wants to get better as quick as possible. So this is a good patient, and he'll probably need orthotics in the future. And he guides people on hiking trips, so he possibly will refer other patients over. Next patient was a 36-year-old with second toe issues. Has a possible nail fungus. I tested it, showed no nail fungus. He has a hammer toe. I talked about anatomic shoes for this patient. Mostly just shoe recommendations. Next was a patient that was a nail care patient. Somehow they got thrown in on a non-routine day, so I did nail care, and they're going to come back on a nail care day. So just so you know, nail care days I do a half day, 1 day a week. All the doctors do just a half day. We put all of our nail care there along with our nail tech. That helps us. Next patient was a 56-year-old status post arthroplasty. This is the second post-op, or the first one after the suture removal, so second post-op. She's doing much better, no need for follow-up for her. Next was a patient that 67-year-old has a ganglion cyst, or a possible cyst. Did not seem to be a cyst, so I ordered an MRI for this patient. Not exactly sure what's going on, but I'm going to do an MRI to kind of see what's going on in her foot. Next patient was a nail sample, was not fungus. And we did a nail sample for this patient, possible fungus, and I told her not to come back. So this is a case where I'll have her come back if it's a fungus. If it's not a fungus, I'm going to call her on the phone and just let her know that is not a fungus, and she doesn't need to follow up. Next patient was a nail care patient, and they also had an IPK, or a possible wart, so I did lesion destruction on that. So for patients that have porokeratomas or IPKs, I say that potentially this could be a wart, and I do lesion destruction for those ones. Next, some reason throw it in another routine. I don't know why I had so many routines this day. I think possibly because I'm not here on Friday because of the 4th of July weekend. That's maybe how they kind of showed up here. The next patient was a exostosis between the 4th and 5th toes. Got x-rays, talked about doing an exostectomy. Patient will consider that and follow up as needed. Next patient was actually, I know, I'm sorry. I had 2 other routine patients. I know why. So what happened is one of my colleagues, he does nail care on Thursdays for the half day, and he was in surgery. And so what I did is I take over his nail tech schedule. So all these were routine cares that were done by the nail tech. So I think she had 4 or 5 patients that were there for nail care. So she did them, and I just kind of documented them. Next patient was an ingrown toenail, not really painful, so I just kind of trimmed it out. It happens very rarely. Next patient was a patient with right foot pain. I did a Medrol dose pack, and I also did meloxicam for this patient. And if it's not better, I'm going to order her an MRI. That was the morning. Afternoon was a 70-year-old patient for left plantar fasciitis. Did x-rays, did an ultrasound, and I did meloxicam along with my foam rolling and night splint and morning stretch. And if it's not getting better, we're going to do Shockwave. Next was a paronychia follow-up where patient's doing better, but they were concerned about fungus. So I did fungus number 1, which is the fungus package, and started them on terbinafine. Next patient was a first MPJ pain. I did an ultrasound-guided cortisone injection for this patient. They'll kind of follow up as needed. Next was a patient with an ingrown toenail, and I did an incision and drainage, and they had some tinea, and I did an antifungal for that patient. Next was a patient that had some posterior tibial tendon dysfunction with pain, and they were casted. We checked for insurance, and they're going to get a medial Blaze AFO. It's a type of AFO that we use, kind of like a Ritchie brace, but it has a little more give on the medial side with a flattening on the medial arch. The next patient was a follow-up. This is one of my old MVP patients, most valuable patient. 33-year-old male with bilateral plantar fasciitis and equinus. So he did 6 sessions of bilateral Shockwave, and then I see him back 6 weeks after. He's doing much better. He's doing well with his orthotics. His Shockwave worked great, and no other issues, so no follow-up for him. Next patient was a 40-year-old athletic guy. He had peroneal tendon pain, so we did x-rays, we did an ultrasound. Ultrasound showed a tear of the peroneal tendon, and I recommended a tall cam boot, and if it doesn't get better, we're going to do Shockwave. I actually recommended doing Shockwave right away, but he wasn't willing to do the Shockwave, didn't want to do the Shockwave. And then the final patient of the day was a patient that had a soft tissue removal dorsolateral foot, and since there was still pain in that region, I did a cortisone injection to calm things down. So that was the day. I will talk to you guys tomorrow.